Denver Health has been at the heart of our city from the start, fueling our passion and building our community. For 150 years, we've grown alongside Denver, expanding our reach with an entire system of care. We're the backbone of our community, and we're here to make a difference for everyone, no matter who you are or where you're going. We're Denver Health. We're with you for life's journey.
My name is Michelle Haas. I'm the Associate Director of the Denver Metro TB program, affiliated with Denver Public Health, and I've been affiliated with the TB program for almost 5 years now. In terms of the importance of the services provided by the clinical pharmacist, I think it's hard to overstate the importance. You know, what we found both anecdotally and then also in some of our data analysis is that patients really do want to receive services in their medical home. And the number of people who have latent tuberculosis, at least here at our institution, is substantial. And so I think that being able to provide this service for patients who are stable, who don't necessarily have to come in to see their primary care provider, they can easily follow up with a clinical pharmacist, I think is improving patient flow, which is one of the metrics that we're hoping to look at more rigorously. And I suspect will also help to improve patient care in general, as it might also allow patients to follow up more easily than to get in to see their primary care provider. A clinical pharmacist is in some ways uniquely suited to offer latent TB treatment follow-up. You know, we're moving more towards shorter course regimens, which invariably include a rifamycin, and rifamycins, as we all know, have many drug-drug interactions and side effects. And so, you know, clinical pharmacist is uniquely suited to answer those questions, and in some ways probably better suited than a provider, even an infectious disease provider, because they're more in tune with side effects and can speak more directly to those drug-drug interactions. In terms of how I'd like to see the role expand and evolve, so one sort of immediate way that we're trying to expand that here at Denver Health is working with another clinic that also has a clinical pharmacist on site to train that particular person to also do latent TB follow-up visits. And so what I'd like to see potentially going forward, if this model is successful, and so far preliminarily it does look like it's successful, is to see how we might be able to use this model to support other primary care providers to provide latent TB treatment in the patient's medical home. Probably one of the most critical pieces that a clinical pharmacist can bring and why it would be important is sort of what I mentioned earlier in terms of being able to speak directly to drug-drug interactions and reviewing those more intimately, and being able to speak about side effects with patients, and really adding that component to the care team, I think, is really important. You know, it adds sort of a different focus than what primary care providers and infectious disease providers will bring. You know, we're in some ways more focused on the sort of the medical aspects, but the drug-drug interactions and the side effects are really important, and there's so many of them with rifamycin-based therapy that I think having a clinical pharmacist and having that expertise is really important.
We're Denver Health. We're with you for life's journey.